Hello, Aggies and friends of UC Davis. I'm Chancellor Gary May, and I thank you for joining us today for our Plugged In event series. We're hosting these virtual events for valued friends of the university so we can stay connected and share the tremendous things that are happening at UC Davis. We've said many times before that UC Davis takes on the most pressing challenges of our time. This is not lip service or some marketing tagline. This is real. And now, more than ever, we are proving this. The speakers you're about to hear from are a perfect example of how UC Davis is taking these challenges head on. As supporters of our university, you play an essential role in moving this work forward and ensuring that our students can stay on the path to success. We hope you enjoy today's program. It will give you an insider's look into innovations at UC Davis that are positively impacting the lives of people, animals, and the environment. Thank you for your support of UC Davis and all we do to make our world a better place.
Good afternoon and welcome, and thank you for joining us today. My name is Michael Larimore. I'm the Dean of the School of Veterinary Medicine here at UC Davis. I am also pleased to be your moderator of today's event, Plugged In. As the Chancellor mentioned in his video, we wanted to create the Plugged In event series for you, the donors of UC Davis, to give you an exclusive insider's look at some of the amazing things happening here at UC Davis. We have demonstrated in more ways than one of how we are living our public research university's mission to help society. In 1 week alone, UC Davis began trials for COVID-19 vaccinations, and my team here at the School of Veterinary Medicine treated more than 1,000 animals affected by the LNU Lightning Complex fire. And as you will hear about, the One Health Institute within the school was just awarded an $8 million grant from the National Institutes of Health as part of the network to study emerging pandemic threats. We have some amazing people at UC Davis who truly care about working with you and for the public to address the ills of our society. We incorporate the spirit of working across disciplines to address the needs of society. And this includes our plans to build our veterinary medical center to advance the health of animals and people, and to studies of the causes of major pandemics like COVID-19. With that in mind, it is my pleasure to introduce to you our featured speaker for today, Dr. Michael Siccardi. Dr. Siccardi is an alumnus of UC Davis 3 times over and has been involved in oil spill response veterinary expert at more than 50 oil spills in the US and around the world. He currently serves as chair of both the National Oceanic and Atmospheric Administrators Working Group for Marine Mammal Unusual Mortality Events, as well as the Global Oiled Wildlife Response System. Dr. Siccardi maintains a very active research program investigating emergency responses involving animals in crisis and the One Health effects of petroleum in the environment, and continues to teach within UC Davis, as well as globally on wildlife health and conservation. He is also a member of my team at the School of Veterinary Medicine, serving as our new Executive Director of the One Health Institute. As Executive Director, Dr. Siccardi is leading a One Health Institute in its mission, which is to solve complex problems impacting the health and conservation, such as the zoonotic disease emergence and biodiversity loss. Today, he will share with you how UC Davis's School of Veterinary Medicine One Health Institute work has been in many ways at the forefront of the university's One Health approach to identifying, preventing, and addressing global health issues, such as the COVID-19 pandemic, and will be essential in driving scientific discoveries forward now and into the future. If you have any questions during Dr. Siccardi's presentation, please type them into the Q&A section on your screen. We will have the opportunity to answer those questions after the presentation. We also will have a short poll right after the Q&A session that we'd like to ask you to take so we can further refine our virtual events. If you could please take just a minute to answer those questions, we would appreciate it. And now, please join me in welcoming Dr. Michael Siccardi.
Thank you for the opportunity to speak to you today about the concept of One Health, its importance in today's society, especially in the light of the current pandemic, and what the School of Veterinary Medicine's One Health Institute is doing to move the field forward. First, the concept of One Health is not new, but the awareness of its value in today's world is. In fact, the School of Veterinary Medicine has been working in this field for more than 50 years. There are many, many different definitions that have been proposed to better describe One Health, but the one we most like is that from the Centers for Disease Control and Prevention. Well, I won't read the entire definition to you because it's on the screen. The key elements to me is it's working at all different geographic levels and working cooperatively to solve large-scale issues. How the context of One Health translates to me is that it's not a defined field or confined to a single definition, but it's really an approach to address larger problems versus a single discipline. We can't stay in our silos, so all disciplines need to work together to answer these large-scale issues. A number of different complicated and diverse drivers and influences can both directly and indirectly lead to large-scale global health problems, and those are the ones where One Health can be the most effective in coming up with solutions. In practice, this equates to experts in all fields effectively and openly communicating, collaborating, and coordinating to address such large-scale, complex, multifactorial issues in order to create a better world for all of us. One very pertinent example of this type of large-scale issue is that of zoonotic diseases, or diseases that transfer between animals and people, and how they can emerge with little to no warning. As Billy Koresh et al. Describes in their excellent paper in 2012, infectious diseases can reside with little evidence in free-ranging wildlife populations. However, as populations shift due to such issues as climate change or human population growth, increased interactions or disease spillover from wildlife to domestic animals can occur, causing disease amplification, as well as modification of the disease organisms to become more infective in nature. As humans then interact with their domestic livestock, or if humans increase the interaction with free-ranging wildlife, these diseases can then be transmitted and further amplified into the human population. With that process in mind, there's a number of different ways that focusing on One Health solutions can help prevent such outbreaks or pandemics. First, through making realistic assessments of our readiness for disease outbreaks and implementing prevention and response measures, we can reduce the likelihood of them occurring, as well as their impacts should they occur. By conducting extensive active surveillance of likely reservoirs of diseases that can affect us, as well as affect other animals, we can establish baselines of endemic disease or disease that is naturally in the environment, as well as better understand what disease organisms are actually out there. Lastly, if we can use all this information to rapidly respond to such outbreaks in an organized, proactive manner, we can reap huge control benefits by reducing the overall health impact to ourselves. The One Health Institute has been focused in this sphere since 2009 and has had tremendous success at working at this collaborative interface. From our broad-based mission to the specific centers and programs that make it up, the OHI has had success due to its focus being global, applying at all different geographic realms, being comprehensive, making sure that science actually informs policy so real change can occur, being holistic, applying an integrated approach to these large-scale issues, and last but certainly not least, employing a collaborative and transdisciplinary approach, making sure scientists and experts in all fields come together for the betterment of society. Over this time since 2009, we've enjoyed tremendous success as a unit, focusing on health-related issues in human populations, domestic animals, wildlife, plants, and the interactions that occur amongst and between them. By approaching important issues with an entrepreneurial spirit grounded in strong science, each of our 5 centers and numerous programs and projects have emerged as world leaders in issues ranging from oil spill response to zoonotic disease modeling to advanced laboratory diagnostics to detect viral pathogens in all animals. As you can see on this screen, we have a huge number of centers and programs within the OHI, and I cannot hope to describe each areas of our emphasis within these 20 minutes. So I wanted to hone in on several that are helping to actively address our current COVID-19 pandemic, as well as to reduce the likelihood that future pandemics will have such a massive impact to our society. The most striking example of our role in the success of COVID-19 is the PREDICT project and its involvement in providing excellent information and coordination to this massive pandemic. PREDICT, a project of USAID's Emerging Pandemic Threats Program, was initiated in 2009 in partnerships with a number of other amazing organizations, with the goal to strengthen global capacity for the detection of viruses with pandemic potential that can move between animals and people. Over the last decade, PREDICT activities have supported emerging pandemic threats preparedness and the global health security agenda, primarily in Africa and Asia. PREDICT has done a number of different things as listed on the screen, but primarily they've initiated a One Health surveillance program, a transdisciplinary collaborative approach to understanding infectious disease risk at that human-animal interface. Over the past 11 years, more than 30 countries around the world now have stronger systems to safely detect, identify, prevent, and respond to viral threats. We have trained zoonotic disease specialists and laboratory scientists in more than 60 national university and partner laboratories to be the best response resources in the regions to assist with safe and secure detection and response to diseases such as COVID-19 and other emerging biological threats. In doing this, PREDICT has conducted a massive active surveillance program, testing more than 160,000 samples in wildlife species, and vastly expanded our knowledge of viruses in these at-risk populations. The PREDICT project has also rapidly pivoted over the past year to be able to assist in the worldwide COVID response. By utilizing these existing systems in the previous decade, we've been able to assist in early detection of SARS-CoV-2, the viral organism that causes COVID-19. We've helped in preparedness activities in the countries in which we've actively participated, and we've analyzed and interpreted results from serum samples and other biological media to determine the real risk in different communities throughout the world. Our experts have also been extremely active in sharing their knowledge and experience regarding coronaviruses and the epidemiology of zoonotic diseases between wildlife and human populations, both with the scientific community as well as the general public through the media. This figure shows the extent of these communications as of 2 months ago. You can see the estimated reach worldwide of the veterinary school's faculty in providing the best scientific information possible to apply science towards effective solutions during this pandemic. With the success of this PREDICT project, many may ask, what is next? How can we better prevent such a terrible loss from ever happening again? The OHI has not only been focused on addressing this pandemic, but also developing strategies and programs to better address those outbreaks should they occur after COVID-19. In short, we are hoping to focus on the vision of ending pandemics from occurring and spreading in the future. Through better understanding the high-risk viruses that may exist in animal populations that potentially could spill over into humans, we can combat uncontrolled disease outbreaks We can protect vulnerable populations. We can avoid the unnecessary deaths of thousands of people due to these spillovers. We can reduce the global threats to society and economies. And lastly, we can better understand the real risk that wildlife play in these situations. To illustrate this enormous task, I'm going to give just 3 examples of different projects that our investigators are actively involved in today. The first of these efforts is our Global Virome Project. This massive billion-dollar effort is to develop innovative network partnerships among multiple stakeholder groups to detect the majority of unknown viral threats within 10 years to better prepare for and stop future epidemics. In short, we hope to detect more than 99% of the existing viral threats to people in the environment. Its multi-pronged approach includes providing bioinformatics to foster new strategies for the development of vaccines, pharmaceuticals, and other new countermeasures, to strengthen global and local capacities to monitor, respond, and prevent spillover while evolving in animal populations, and to inform health policy, patient treatment, animal conservation, and the global economy, and to build a world safe from the threat of emerging viral diseases. Obviously, I cannot cover in any great depth the scope of this massive effort, but I encourage you to visit our website to learn more about this important and critical project as we move forward. The one thing I can share with you at this point is one of the first outcomes of this effort. Through the PREDICT project and the GVP, we've developed Spillover, a viral threat ranking system to evaluate different viral agents and how they compare to one another in their potential to lead to a global pandemic. While this effort was developed before the current COVID-19 outbreak, we do see that a SARS-like coronavirus outbreak did come in at position 3 in looking at the highest risk pathogens of known viruses. Hopefully, as we learn more in the future about both known viruses and detect currently unknown viruses, we can use tools such as these to better direct prevention measures, research efforts, and funding to mitigate future disasters from ever occurring. The second project I wanted to describe is our current USAID-funded effort, the One Health Workforce Next Generation. The focus of this work is to empower university faculty and staff in Africa and Southeast Asia to become global leaders in preparing current and future health workers to prevent, detect, and respond to emerging disease threats. In essence, we want to be teaching the future teachers to better prepare areas of high risk, such as Africa and Asia, to emerging zoonotic pathogens. The key objectives in One Health Workforce are to develop, deliver, and institutionalize training and educational opportunities in alignment with prioritized One Health core competencies and technical skills. To establish systems, policies, and procedures to assess and track multi-sectoral workforce placement, performance, and impact, and to strengthen the functional and organizational capacities of regional One Health university networks to receive and manage direct donor funding. While this project is only in the early phases, and in the first year we've had to pivot to address specifically the COVID-19 issues, we're looking forward to expanding the tenets of One Health into these areas to better assist people to teach others the importance of One Health in their local communities. The last project I'll mention is our PREEMPT program. This 3.5-year DARPA-funded project seeks to preserve the health of communities around the world by containing emerging infectious diseases in animal populations before they can threaten humans. The focus of PREEMPT is to lead research to better understand transition dynamics within 2 key diseases, Lassa fever and Ebola virus, and to develop innovative countermeasure strategies with the potential to eradicate these viruses in the wild. The key activities that we're working on within this project are to trap and collect samples from endemic rat species in Sierra Leone, to develop unique vaccine tools designed to prevent viral transmission from these animals to people in the region, and to use these data from field and laboratory studies in combination with advanced modeling to predict viral spillover potential and actively identify optimal timing for delivery of these vaccines targeting virus elimination. Similar to the One Health workforce, this project is in the early phases of work, but we're extremely positive on the potential to identify unique and effective ways to deliver vaccines directly to the source of these viral threats to people before spillover occurs. So in conclusion, I hope you've been able to, I've been able to describe the vast benefits of approaching large-scale issues using a One Health approach. There are many, many different global issues that ideally can be addressed in this manner, such as health-related impacts to global warming, as one example. The current weather shifts we've seen both here and Louisiana this week, and wildfires occurring all over the West, are just two stark examples of how our environment can have massive impacts to ours and our planet's health. The OHI is actively engaged in such important activity and hopes to expand and continue our role and impact in the future. However, as COVID has touched each one of us in our daily lives over the past 6+ months, I hope this presentation has illustrated just how UC Davis, the School of Veterinary Medicine, and the One Health Institute are all actively involved in improving awareness for zoonotic diseases. And hopefully, will continue to help move knowledge and information from detection of diseases late in the process when they occur in human populations, and move the detection and information upstream in time to reduce eventual pandemic infectious disease threats in the future and lead to true zoonotic disease preparedness within our society. Thank you very much for your attention today. We truly appreciate your time in signing in these extremely trying and difficult periods. I'd like to leave you with a quote from an individual who is far more eloquent than I am, that I feel truly embodies the spirit that we need to embrace in these challenging times. I'd be happy to answer any questions people may have, and thank you again for your attention.
Thank you, Professor Siccardi, and I would challenge you. I think you are just as charismatic as Dr. Fauci. Before we move into questions from the group, I do have one that I know you can answer and you've probably thought a lot about. Some reports state that the coronavirus was the result of a cross-contamination between animals and humans at a food market. And considering this and thinking about what the scientific and general public's attitude towards One Health approach, can you sort of address that origin? I know it's much more complex than that, and talk a little bit about that. I know a lot of people are curious.
Yeah, thank you for the question. And again, thank you for everybody for signing in today to listen to this. I think the issues related to COVID-19 and SARS-CoV-2, we're learning new information every day as far as how the disease emerged, what the infectivity of the virus is, where the sources are. I think there's a huge amount of information that continues to come out, and we're learning new information all the time related to it. I do think there are risks associated with our increased interactions with free-ranging wildlife. I think there are increasing risks associated with potential diseases spilling over from wildlife diseases to domestics and to us. But the simple fact is that we need additional information. We need better research. We need more active surveillance to better understand what those real risks are to us moving forward, so that we can base some of the mitigation measures, and some of the information on the best science possible.
Thank you so much. You mentioned the environment as one of the sort of triads of that One Health approach. And we have a question from our audience about that. And the question is, could you speak to the environmental efforts that are being put forth in regard to this crossover or spillover type events? How does the environment influence those?
Sure. As you noted, the environment is a key part of the One Health paradigm. With the environment, what we're learning using the One Health approach is we cannot tease apart the impacts on our animal populations, our human populations, the environmental health in plants. We cannot separate those out. So with the environment as an example, as human populations increase, we have decreasing borders between free-ranging wildlife and us. We have increased interactivity between our domestic animals and wildlife that may harbor diseases. And so the impacts to the environment can have direct relations to how we and our domestic animals can actually interact with wild animals. The environment as well, a decrease in environmental health, if you will, can actually increase the stressors to us and other animals. Increased stress can result in increased disease. And so think of the environment almost as if it's our immune system. So the environment can be challenged. Decrease in environmental immunity can cause increased perturbations to that. So the simple fact is all of the different elements within One Health, people, animals, the environment, if we're talking about true health, they're just so linked together. It's very hard to differentiate at any point if we're looking at things truly in a holistic manner.
I love that analogy of the earth as an organism, and we're all connected.
Exactly.
Another question from Cheryl within our audience is really asking about international collaborations. I know there are many that the OHI interacts with. In particular, is China involved as part of this effort in terms of either any of those programs you mentioned, and if so, how?
China wasn't involved in the PREDICT project through some of our other partners. Some of the work that we're doing does relate to China directly and indirectly. It's difficult to tease apart the risks associated with some of the different countries. It also relates to some of our funding sources and where the funding needs to go to as far as exploring the potential risks. I think it's important to think more holistically as far as the different countries involved and the different regions involved, and really think of it from a risk perspective as far as some of the wildlife and domestic animal populations. Some of them don't know boundaries. So thinking of it from a true risk perspective to better understand the dynamics of health, I think is much more critical than looking at some of the human related boundaries that we've set up.
I think the next question is related, and that is thinking about COVID-19 reservoirs. The question comes in about from Mariam about how would these global changes, could we be better at picking these types of pandemics? You know, Tony Fauci just had an article in which he was quoted as saying we're in the era of pandemics. Mm-hmm. But in the future, sort of projecting into the future, how are your efforts at detecting these in the reservoirs so that they don't spread to humans? Could you speak a little bit about that?
Sure. I think PREDICT is a perfect example of some of the advanced work we've done by really doing a huge effort towards better understanding some of the endemic diseases, the naturally occurring disease organisms that occur in some of the high-risk reservoirs out there, free-ranging wildlife in particular, through us testing over 160,000 samples in different countries and different regions to better understand the viruses that currently exist, to categorize them using advanced laboratory techniques, PCR and the like, to better understand some of those risks ahead of time. So should those diseases cause outbreaks, we have a much better way of addressing them quickly and trying to decrease the curve, decrease the overall impact to human populations right from the start. If we can push that timeline forward and decrease the actual effects in people, that's going to be much more effective, both from a human health and livelihood perspective, as well as an economic perspective. By doing that, we can much better understand the information moving forward.
Yeah, having that information really helped in terms of standing up the diagnostics, I know, with COVID, and understanding the bat reservoirs and having those tests available was almost at record speed, and the amount of sequencing of all of those isolates around the world, which was incredible, really helped. The next question is related to this as well. You know, when we think about animals and zoonotic infections, William asks, as it relates to people, are wildlife or are domestic animals more of a threat in terms of zoonotic diseases?
That's an excellent question. I think they're different. The challenge with wildlife is that we don't have the ability to test as frequently or as many as in our domestic animals. There are diseases that are likely out there that we don't know about, mainly because we haven't tested or even found the wildlife that are there. So I think we have a much better understanding of disease as it relates to domestic animals. But the other side of that is our interactions with domestic animals are much more frequent. We're going to be much more in direct contact with those animals, so the likelihood of transmission, should they be in domestic animals, is going to be higher than in free-ranging wildlife. So I think both are at a risk, and that this again is why it's critical to understand diseases that exist both in domestic animals as well as free-ranging wildlife, so we can get a much better appreciation for the true risk to us.
One thing you mentioned is the next generation of healthcare workers as one of those projects. But the next question from that was typed in, it really involves the educational aspects. How are some of the ideas of this One Health approach being introduced to students? And I know that this, when that's referred to, I assume students across the spectrum within all of the university. How are they introduced to this interconnectedness that you talk about?
Well, I think the better understanding for the importance of One Health goes across the education spectrum. I mean, the root of the mission of the One Health Institute is core to the mission of the School of Veterinary Medicine, as far as better understanding the interactions between humans, animals, and the environment. Even the Chancellor's introductory video today echoed that the key interaction between people, animals, and the environment we live in. So I think the better understanding of One Health principles is definitely going at every different level within the university. We're also hoping that that goes even further into high schools and elementary schools, so that people truly understand that our health and the health of animals, the health of our planet, are so intertwined that you really can't tease them apart. And that truly is the core of One Health.
You know, you mentioned partnerships, and I know you have extensive partnerships within that kind of approach. And one of the specific questions from Adrian in our audience is the Nature Conservancy, which many people are aware of and their good work. Are they part of an organization like the One Health Institute?
We've worked closely with them and other organizations for some of our wildlife work. So again, thinking about the One Health Institute broadly, we have a number of centers. Our largest center is the Karen C. Dreher Wildlife Health Center. We work fairly closely with Nature Conservancy and other NGOs to look at wildlife conservation and land conservation as it relates to wildlife health. So we're always looking for increased partnerships and an increased ability to have what we do make the broadest impact possible for our society.
Another great question is about the oceans, and I know much of our planet is covered by the oceans, and I know that you're very much involved in that. Could you describe a little bit about some of the work that's being done with marine life as it relates to understanding the effect on marine life, but also on people and how we interface with the oceans?
Sure, absolutely. The oceans is one of our key ecosystems that many of our programs within the One Health Institute works in. We have a number of different programs. The CDOC Society is a marine ecosystem health program that's based in the Salish Sea at the Washington-Canada border. They've been doing tremendous work for 20 years, looking at how wildlife and the health of that marine ecosystem in that key area is so intertwined. We have the program, I'm fortunate to be the director of the Oil to Wildlife Care Network, where we respond to oil spills anywhere in the state of California. But we're actually applying that model both nationally and internationally to be able to assist in oil spills that should occur. Have another program that's directly collecting derelict fishing gear off the coast of California to try to remove that garbage before it can actually negatively impact wildlife. We have a program in South America that's looking at marine health in Argentina. So we have a whole host of programs and projects, everybody working together to better understand the health-related impacts in the oceanic ecosystem and how we can improve that.
Yeah, so important of how well we're connected, but also how important the oceans are to our survival in the environment. Another question revolves around how the research that we do within the university influences policy, and you did mention policy as well. Can you maybe give us a few examples of how the research has influenced policy and how we can educate and really have a science and evidence-based science around policy in this country, which is at times lacking?
It's an excellent question. We're always looking to see how we can better inform policy from all of our work. What we don't want is our research to simply exist in the journals that are out there. We want that information to directly affect change to better our livelihoods. One discrete example of that is some of the work we did with lead intoxication in California condor. Was found that lead was at extremely high levels in condor within California. And through research looking at that, we were actually able to change the laws that govern where lead shot can be used, from excluding it from areas where condors may be preying on animals that are shot. Other examples are, again, within California and oil spill response. Through the successes of the Oil to Wildlife Care Network, managed by the School of Veterinary Medicine, we've been able to require those people who are potential oil spillers in the state of California to have a contingency plan that requires them to provide the best achievable capture and care to oil-affected wildlife. So that if they spill, they understand that there are going to be people going out there and recovering the animals. And that is in law to be able to do that in the most effective way possible. So there's a whole host of examples, and we're always looking at ways of making sure what we do can change our society.
And I know many of those political leaders have been to our campus to learn more about what we do.
Absolutely.
The next question is a little bit more specific. Kimberly asked about plastics, and we hear a lot about that, both from the perspective of polluting our oceans, but also affecting our wildlife. Do you have any research on plastics and mitigating the effects of plastics in our environment?
No, that's a great question. We've done quite a bit of research looking at the effects, especially in the marine ecosystem, the effects of plastics, monofilament fishing line, or again, derelict fishing gear on the effect on seabirds and marine mammals, looking at how frequently those animals are caught. We have researchers within the One Health Institute that are currently looking at microplastics, looking at some of the very small broken down pieces of plastics, if they're ingested in marine wildlife, what the negative effects might be on that. So we're actually looking at those things in concert with other researchers within the school. So plastics, it is a huge problem. And it is something that we want to continue to look at moving forward even more closely.
With the announcement this past week from the National Institutes of Allergy and Infectious Disease that UC Davis and the One Health Institute, led by Dr. Christine Kreuter-Johnson, is part of a new network from NIH this time. Could you describe that, kind of some of the goals of that research and that network that's just got funded?
Sure. So they have put funding in to fund 11 different centers throughout the United States to be able to better understand infectious diseases. And it's a combination within those centers themselves. Different universities are actually focused in at different levels. Dr. Johnson's work here is focused in an advanced disease modeling to be able to better understand and predict how infectious diseases can actually cause potential problems so that we can move that timeline forward to mitigate them early on. So using advanced statistical modeling and mathematical modeling allows us to better understand these issues from occurring even before they happen. So we're very proud to be part of that larger scale funded projects, and we're very proud with Dr. Johnson and her team for being part of that.
Yeah, and congratulations to the entire team, that major accomplishment. We look forward to hearing more about that. I think another question, it goes back a little bit to the education. You mentioned the spectrum and, you know, the global disease biology undergraduate major, that is a collaboration with the College of Agriculture and Environmental Sciences and the School of Veterinary Medicine, really grew out of a One Health approach, both in animals and in plants. And Professor Rizzo has got a very active program there, and it's a major undergraduate program. So we had a question from Christine on, are there opportunities for undergraduates to work in the One Health space or in the laboratories or in the field?
Absolutely. One of the things that we've tried to do is to do what we can within both the undergraduate and the graduate fields to advance One Health, and that Dr. Valtrina Smith has done a great job in doing that, and with our Office of Global Programs as well. We do want to increase our ability to help out in that way. I've had some initial conversations with that program itself, which is growing tremendously within UC Davis, and to see how we can better partner with the undergraduate programs to be able to share our knowledge and our experience, but then also have undergraduates and the programs themselves better inform the direction that we're headed as far as the research and the projects that we're doing. So we are looking forward to increasing that, hopefully in the future, when we can all meet together face to face again.
That's exciting, and I know it stimulates a lot of the undergraduates in their career opportunities and inspires them sometimes to work in global health or on the international forefront. Another question revolves around really what we heard a major donor this week really helped support in innovation entrepreneurship. Are there opportunities for small businesses, or are there innovation entrepreneurship opportunities through this One Health approach?
I think there absolutely are. One of the reasons why both the Wildlife Health Center and the One Health Institute has been so successful is we treat our programs and projects almost like small businesses. We do have a number of different ideas that our different investigators are interested in pursuing. We do look at them to see not only the scientific value, but whether or not they're sustainable and whether or not they're going to implement true change. And so we do approach things in that very entrepreneurial spirit, looking at having advisory boards to be able to better direct how those programs can be doing. So it's often a very different model than what is seen in the university systems, but it's a model that allows us to work very effectively with both small and large businesses, because we have the ability to convey our message effectively. We understand the cost and benefit associated with what we're doing. And we're, again, able to apply the strongest science possible towards affecting real change in society. So that it is a tremendous opportunity for us, and we're always open to look at other partnership opportunities in that way.
Really taking those ideas all the way to market in that case. Larry Stewart asked a very important question about one of our primary partners, and that is medicine, and within the School of Medicine. And I know you have several programs that are specifically involved within the pre-professional or interprofessional health area with the School of Medicine. Can you talk a little bit about, I know you have is it called an RX for One Health program? And I know that specifically with medical students, but you might have others as well. Can you describe some of those?
Yeah, again, it's a very good question and very pertinent. Thinking about the context of One Health being animal, human, environment, and plants, it's so important to bring the faculty from all the different departments together to work together on projects. So within the School of Veterinary Medicine and School of Medicine, we do have crossover programs where even at the veterinary students and the human medical students, they're working together on One Health issues within the classroom to be able to, so they can speak with one another on zoonotic diseases and other issues that can cross species boundaries. Our RX One Health program, it's an opportunity where we can take medical professionals into the field and have them experience One Health opportunities all over the world to be able to, again, better understand and apply the principles of One Health to some of the health-related issues all over. We have close collaborations with our medical faculty. You yourself, Dean Larimore, have an excellent podcast program with the Dean of the Medical School. So we have a tremendous crossover between the medical professions here at Davis, and I think it's one of the best examples with any university system of that close collaboration between the human medical and the veterinary medical fields.
We have a question from Joseph about our international collaborations or international organizations, specifically WHO, and if you have any work with them, but also you might describe some of the other international organizations that must be involved, obviously, in some of your work.
Yeah, we do work with WHO, FAO, many of the larger international organizations that are focused in on global health and the health of animals and humans and the environment. It does, in essence, take a village. There are all sorts of organizations that we work directly with or our partners within our programs work closely with. And really, I mean, that is the key of anything that we do. Again, thinking about that transdisciplinarity approach, making sure the professionals in all the different organizations and fields are working together to be able to solve these large scale issues. It's so important so that individual fields aren't working in single silos in a vacuum.
I know that's we've discovered in our podcast with Allison Bashir, the Dean of the School of Medicine, that as we begin to look at it, we have so many areas that we collaborate with the School of Medicine, and it's a wonderful collaboration that involves responding to COVID, but it has a rich and deep history here. You know, one thing that has been asked is, and you mentioned it earlier on in your presentation, the word capacity building. What do you mean by capacity building, and why is that important as we work with our international partners?
So capacity building, in essence, is through our work, helping others to expand their local capacities. And so instead of us coming in, doing the work and leaving immediately, it's us helping the local communities and local experts to establish laboratories, to learn skills and techniques to be able to train individuals, to be able to establish more of a local base of operations. The simple fact is that these issues and problems are larger than any one university or one program can address. So for us going in and, for example, One Health Workforce, for us helping to teach the teachers so that they can teach others and so on, what we're doing is building that innate capacity within different regions, helping to be able to grow things beyond what we can do directly.
Can you in your background, you're a wildlife veterinarian, and to be curious to know how you got started as a youngster and inspired to do that, because we have, of course, a lot of people that are interested in this field. But what inspired you early on and why did you get into wildlife, and what led you to this point?
Working with wildlife has been the only thing I've ever been interested in doing since the age of 4. Watching Jacques Cousteau in The Living Seas, learning about how the marine systems work has always been fascinating to me.
Mm-hmm.
So that's always been my lifetime goal, as far as working with wildlife and the marine ecosystems to be able to better them and us. Coming to veterinary school, expanding that viewpoint, learning the importance of wildlife and marine systems, but learning they're part of a larger system that involves land and air and everything, and seeing the importance of One Health and how it can affect all these different things and how wrapped up in overall health it is. It's allowed me to take a much broader perspective and much more rewarding for me in that career.
And we're so glad you're involved. You inspire all of us with your work and with your passion. Maybe a last question would be really around the area of the future. What are 1 or 2 goals that you have within the One Health Institute that you'd like to see accomplished going forward?
What I think in the immediate term is to work on some of the programs that relate to zoonotic disease prevention and understanding. So One Health Workforce, hopefully the Global Virome Project, projects such as that to better understand kind of the immediate threats and mitigate that. Moving forward, I would love to continue to explore partnership opportunities and to increase the collaborations we have to address other large-scale issues, global warming, issues that have direct health-related impacts at a broader scale. I think we have the capability, and as veterinarians, I think we do an excellent job in bringing together a variety of different fields together to focus on large-scale health impacts. That's how we are trained within the School of Veterinary Medicine. And what I'd love to do is to take that approach and, again, building stronger collaborations moving forward to continue to address some of the key broad-based global health issues that we're facing.
Well, thank you so much, Dr. Siccardi, for your thoughtful answers in your presentation. That was wonderful.
Thank you.
What everybody should start to see now is a poll on your screen. So if you could please just take a few moments to answer the poll. This is very important for us. It really helps us in terms of planning for future events that you hopefully will be listening in for. I'd like to thank Dr. Siccardi for a great presentation, and to thank all of you for joining us today and asking such great and interesting questions. We couldn't tackle such a complex and complicated work like One Health without the philanthropic support from people like you. Thank you. Your support is essential to ensuring our UC Davis can have a positive impact on the lives of our students and the health of all of us. With this in mind, we hope you might consider to make a gift to UC Davis, the One Health Institute, the School of Veterinary Medicine, or another area of UC Davis that speaks to your philanthropic passions. If you are interested, please feel free to contact Dr. Sicardi, Hamie Sevenin, or myself, and we'd be happy to assist you. And our contact information is coming up also on your screen to allow you to contact us, and we really encourage your questions. Before we go, I would also like you to know that we have 2 upcoming events that we hope that you attend. The first is the next virtual event of our Plugged In series, and this is going to happen on September the 9th at 4 p.m. So mark your calendar. That's 4 p.m. Pacific time. So it will feature Dan Sperling, who is the founding director of the world-acclaimed Institute of Transportation Studies at UC Davis. And any of you that have ever heard him talk know what a great expert he is in this area. The event will be primarily a Q&A, so you'll have the opportunity to ask your questions about sustainable transportation, something that is a tremendous impact in all of our daily lives, directly to Dr. Sperling, who is an international expert. It's sure to be a great event, so please tune in. The second virtual event is going to be an innovation spectacular. And I can't say much beyond that. It's a tightly held secret, but it is happening on October the 10th at 4 p.m. Pacific Daily Time. And I've heard it's going to be an exciting, inspiring, and feel-good event. And who doesn't need a little feel-good event right now in these times? So mark your calendar for September the 9th and October the 10th. And emails with more information for both of these events will be coming to you very soon. On behalf of the university, the chancellor, and Dr. Sicardi, and all of us, thank you for joining us today. We hope that you stay healthy and safe, and we look forward to connecting with you very soon. Goodbye.